Hi, my name's Joshua Fries, and I'm going to be doing my presentation on pinworms. As you can see, the picture on the slide is showing you what pinworms look like and their approximate size. So pinworms are also known as Enterobius vermicularis. They're a small, thin, white roundworm, as you saw on the previous slide. They're most common in children, and they're also the most common worm infection in the United States. Humans are considered the only host for this parasite, and they reproduce sexually with a male and a female in the intestine of a human being. And this is an easily treatable infection, as I will talk about later. And pinworms can easily be prevented by washing your hand. So as you can see from the picture of the child's hand with soap, children not washing their hands and then touching toys or sandboxes or anything like that is a very common way that pinworm infections are formed. So this is a world map of roundworm infections. Pinworms are a type of roundworm, and they are one of the most common or the most prevalent roundworm infections out of any roundworm infection. So, as you can see, even though I mentioned that in the United States, this is the most common worm infection, compared to other countries in the world, the US isn't even really close. So the darker the red color, as you can see primarily in parts of Africa, has the highest rate of roundworm infections. So you get such high numbers of roundworm infections in developing countries because they lack things like clean water and access to basic hygiene like soap and stuff like that we have easy access to. And with these infections, especially with pinworms, washing your hands and just being wary of preventing this from happening to begin with is the best way to do it. And on top of that, as I'll talk about on the next slide, pinworms can easily be infected by yourself, so you can get the infection and then reinfect yourself really easily. The drugs that are used for treating this really help prevent this, and in countries like Africa, they don't have as high access to these drugs. And really interesting, the article that I actually got this map from, they looked at how much it would cost to make it where we wouldn't have any roundworm infections worldwide. In a lot of the countries that you're seeing in the dark red, it was about 57 cents per citizen. So that's a pretty low. The drug isn't over the counter and not very expensive at all, and does not require many dosages. So on to the life cycle of the pinworm. It as I stated previously, it's most commonly infected. You most commonly get infected by touching something, so through direct transmission, but you can also get infected through indirect transmission by having an open wound and the eggs of the pinworm getting inside that open wound. And so with this being caused by direct and indirect transmission, it's very easy for it to get into people who aren't keeping up on their hygiene, but it's most commonly gone through direct transmission, and with the example that I gave about children in a sandbox or touching toys, and then touching their mouth, and then once they touch their mouth with the eggs, which are sticky, so they can easily stick to these areas, it then gets ingested by typically the child and then moves throughout their system. and then the larvae will hatch in the small intestine, as seen in 3 on the chart. And then once the larvae hatch, you get the adults in the lumen of the cecum in the large intestine. And then once you have both the male and the female adults, they reproduce. Typically, after the male and the female mate, the male usually dies in the body, and then it's just passed naturally. And then the female works her way towards the rectal area, where she can be alive for anywhere up to about 2 months or sometimes longer. And then she'll usually pass on her eggs, either by just getting by having just so many eggs that she pretty much bursts and dies, and then the eggs are stuck around the rectum of the human, or by her crawling out of that the rectal area, and then leaving eggs around the anus as she crawls out. And when I was talking about a person kind of reinfecting themselves, it's kind of through this process when the female lays her eggs, and then the person itching their anal region and then touching their mouths, where then they can then get a new infection, more worms formed, more eggs laid, and so on and so forth. So some symptoms and treatments when it comes to pinworms. Some symptoms are, as I just stated, itching of the anal region. The itching can get pretty painful and lead to things like insomnia, because you can't fall asleep. It itches so bad, and it can also lead to abdominal pain. And with it leading to abdominal pain, this is actually an interesting kind of like tidbit about pinworms, where a decent amount of researchers think that they cause appendicitis because of the abdominal pain and the fact that they're in the adult stage when they're around the appendix. And there's been research looking at this issue for about 30 years, and it's kind of all been inconclusive. Some researchers say that it does cause appendicitis. Other researchers come out with articles that say it doesn't, and it's still pretty unknown, but just an interesting tidbit about pinworms when it comes to the abdominal pain. And then some treatments to get rid of the pinworms. As I stated before, you can get them through over-the-counter drugs. On the right, you see mebendazole, which is a common over-the-counter drug. You actually typically have to take more than one dose. So the first dosage would be when you're finding out that you have the pinworms, and then you're taking it to get rid of them. And then physicians usually say about 2 weeks later to take the dose, to take more of the medication. And this is because the drugs that they have for treating pinworms can only kill the adults, and they can't actually kill the eggs. So when it comes to a person reinfecting themselves, this is one of the biggest reasons that they do it, is because if you've reinfected yourselves and you still have the eggs in you, the drugs aren't going to do anything until they hatch and turn into adults. So that's really important when it comes to treating this disease, or this parasite. And then an interesting article that I found on pinworms has to do with immunocompromised patients, in this case specifically tuberculosis, and being more susceptible to intestinal parasites. So the conclusions that they came to is that around 48% of patients with TB had a higher rate of about 48% of patients with TB had roundworm infections, and specifically pinworms was the highest roundworm infection that they had. And this was also statistically significantly higher than the healthy person's rate of pinworm infections. And this is also important because when you look at the world map that I showed earlier, Africa had certain parts of Africa had the highest rates of pinworm infections, and with developing countries having the highest rate of pinworm infections, it's and on top of that, having other diseases like TB, having multiple of these diseases, even though pinworm isn't horrible for you and more causes an irritation than being a life-threatening disease, it combined with something like TB that already makes you immunocompromised can make it worse, because the itching and other symptoms it causes can create a breeding ground for more bacterial infections and just make your life harder and make you more susceptible to a virus if you're not getting a lot of sleep and your immune system's already immunocompromised and things like that. So I thought this was a really interesting and important, since a lot of those diseases that make you immunocompromised are in areas that have a high rate of roundworm infections. And here's just some more excited on where I got my information about pinworms, and I hope you enjoyed my presentation. Thank you.